It is Wellness Wednesday, and today in the sponsored segment, we are talking to Dr. Margaret Fry. She's a neurologist at Memorial Healthcare's Institute for Neuroscience. She's here to discuss spinal muscular atrophy. Good morning to you.
Good morning.
We look forward to talking to you with your expertise this morning. You know, first off, what is spinal muscular atrophy, and how does it affect the body?
Spinal muscular atrophy is a genetic disease that causes poor function and deterioration of your motor nerves. Those are the nerves that make you move, provide your strength, and let you do everything.
So it's really a wide impact on how you live your everyday life.
Wide-ranging thing. It can affect anything from just your balance and the way you walk to your ability to breathe and swallow.
My goodness. So how is that diagnosed then? What are you looking for?
So typically, spinal muscular atrophy manifests as weakness, and it can manifest at any age. It is now part of the newborn screen in all 50 states because identifying spinal muscular atrophy in a newborn is an emergency. You want to get treated, started as quickly as possible. If you can start treatment for it in the pre-symptomatic phase, you can dramatically blunt the effect of the disease and impact survival.
It's my understanding there are different categories to this disease?
You are absolutely right. There are essentially 4 types of spinal muscular atrophy. The most severe type, by natural history, if you don't intervene, will cause a respiratory failure and death by the age of 2.
Wow.
The milder types may not manifest until you're an adult, so there's wide variation in the disease, the way it looks, as well as its impact on the person.
Well, let's talk more then about treatment options. What are those?
There are currently 3 FDA-approved treatment options for spinal muscular atrophy. In children under the age of 2, you can use gene replacement therapy, which essentially will provide the gene that is missing in those patients so they can produce the protein they need to make their neurons function more normally. Again, this will dramatically impact survival and function in many, if not most, patients. The other 2 types of treatment are approved for all ages. One is delivered via a intrathecal injection, which means that you put the drug directly into the spinal fluid. The other is an oral medication, and both medications essentially bypass the patient's genetic mutation that causes them to have disease symptoms. Again, those medications can also dramatically blunt the effect of the disease and improve the patient's prognosis.
Now, there are drug trials taking place at Memorial Healthcare's Institute for Neuroscience. What does the future look like for neurology patients?
Bright. When I began practice approximately 13 years ago, many of the drugs we currently use on a day-to-day basis weren't even on the horizon. The treatment options for neuromuscular disorders, as well as neurological disorders in general, from multiple sclerosis to Alzheimer's disease, migraine, the treatment options are rapidly expanding. At Memorial, we are currently running somewhere between 25 and 30 different trials looking at the impact of medications across the spectrum of neurological disorders.
Wow, so those trials, they open up future advancements. And
they do.
It sounds like, you know, again, a serious condition, but some hope there with some of these treatment options.
Definitely hope. The treatment options have completely changed the course of the conversation for these patients. It is no longer always what is worse. Now I can ask the patients what's better.
That is certainly encouraging to hear. For more information, you can go to the website on your screen, and we thank you, Dr. Fry, for filling us in with this important information. Thank you.
My pleasure.